Hello, I am Dr. Sanghnayak Meshram. I am a psychiatrist practicing here in Mumbai. Today we are going to talk about headache. Headache is one of the most common occurrence in my clinic. The most common headache which I have seen in my clinic is migraine headache, followed by tension headache. Then occasionally I see cluster headache, and then I see headache because of medical reasons. So migraine headache, which is one of the most common headache, has different presentation as the age grows. In childhood, it may present like pain in abdomen, recurrent bouts of nausea, vomiting, and then gradually as the age advances, the presentation increases. The typicality of migraine headache is that it is mostly unilateral. The headache is throbbing, as if pulsatile throbbing headache, and it may or may not be associated with aura. Aura may be visual or sensory. In visual aura, we may see flickers of light, then we may see black spots, and sometimes there will be sensory aura in which there will be tingling and numbness in the limbs, and also sometimes it may be associated with giddiness. So unilateral headache with or without aura, if it is gradually increasing, remains for 4 hours or more, and gradually it increases and it increases with your routine activity. This is very important. If the headache increases with the routine activity and it compromises our daily life, then it may be a migrainous headache. The second type of headache which we are seeing nowadays is tension headache, which is typically on a rise these days. Tension headache, it remains throughout the day. It has a sensation of compression of the brain. There is compression on the head, and also sometimes we feel like there is a lot of heaviness over the head. This thing continues throughout the day, but we are able to do our routine activities regularly with this. Okay, this may worsen if there is sleep deprivation or if there is sudden changes in life. So this is tension headache. And then the third, which is very rare, is cluster headache, which is more commonly seen in males, which happens in clusters, means which is there for 5 to 7 days continuously, and then the inter-headache episodes. Interval is a long interval. During this cluster headache, it is mostly unilateral. It's throbbing. It's mostly fronto-orbital. It's here. It makes all this area red. There is watering from the eye, watering from the nose associated with it, and it mostly is aggravated after intake of alcohol. So these are 3 types of headache. Then there are other headache which are because of trauma, head injury, anything which is secondary to any other medical conditions. So these are few types of headache. So we'll mostly discuss about 2 major headaches: the migraine headache and tension headache. So for tension headache and migraine, the migraine headache has got different triggers. So everybody who has got headache should have a headache diary, should note down his trigger, and should always try to prevent those triggers. Some people get headache after remaining hungry for a long time, when they are sleep deprived, when they are using mobiles for a long time, when they are in sunlight for a long time. So such triggers, some specific foods are known to cause headache, migraine headache. So that should be found out and that should be prevented. This for migraine headache. In tension headache, there are counseling, therapy, decreasing the stress level, regular exercises, yoga. This will definitely help in tension type of headache. And the medications which are used in headache, there are of 2 types. One is acute medication and the maintenance medication, or both of these should be taken under supervision. The medicines which are used to abort an migraine attack should always be with the patient, and they should always see that if they are finding that after the headache goes, if the visual aura or something remains for a longer time, if it is not clearing, they should immediately consult the physician or the treating psychiatrist. So regular exercise, not missing the medication, not missing your meals, these few things, drinking lots and lots of water, these few things if done regularly, the episodes of headaches can be decreased, and we can have a healthy life. Thank you.